Gentlemen, before you scroll away, I want you to give me just a few minutes of your attention, because what we're about to discuss could make a real difference in your health, your confidence, and your future as a man. Many men ignore the earliest warning signs their bodies try to send them. They assume everything is normal. They convince themselves that a small change is simply part of getting older. But sometimes, those quiet changes are your body's first request for help. Let me ask you something. Have you ever noticed a difference in your erections, your sensitivity, or your desire, and then told yourself, it will probably go away, without giving it another thought? If you have, you're not alone. I meet men like this every single week. The problem is that what seems like a minor inconvenience today can eventually become a much larger health issue if it continues to be ignored. Today, I want to walk you through 10 things you should never do to your penis. These are everyday habits, common mistakes, and overlooked behaviors that slowly damage erectile function, reduce confidence, and affect overall quality of life without many men realizing what's happening. By the time you finish watching, you'll understand exactly which habits deserve your attention, how to better protect your erections, and what practical steps can help preserve intimacy and sexual health for many years to come. Before we begin, I'd love to know where you're watching from. Leave your country or city in the comments below. I truly enjoy seeing people from different parts of the world coming together to learn about men's health and support one another. And if you appreciate honest, science-based information without unnecessary myths or false promises, don't forget to like this video and subscribe to the channel. Your health deserves facts, not misinformation. One of the biggest misunderstandings I see is that many men believe the penis works independently from the rest of the body. That simply isn't true. Your sexual health reflects your overall health more than most people realize. An erection depends on healthy blood vessels, properly functioning nerves, balanced hormones, and a calm, healthy mind. If any one of those systems begins to struggle, your penis often becomes the first place where those problems reveal themselves. That's why these conversations are about much more than sexual performance. They're about protecting your heart, your circulation, your hormones, and even your long-term well-being. Research has consistently shown that men who develop erectile dysfunction are more likely to experience cardiovascular disease, stroke, diabetes, and other metabolic conditions in the years that follow. In many cases, erectile problems appear long before a heart attack or other serious illness. Think of your penis as an early warning indicator. Just as the dashboard light in your car alerts you before the engine fails, changes in erectile function can warn you that something inside your body deserves immediate attention. Ignoring those warning signs doesn't make them disappear. It only allows the underlying problem more time to progress. If this is your first time visiting my channel, welcome. I'm Dr. Jocelyn, a board-certified urologist, and for years, I've had the privilege of helping men improve their health, restore confidence, and continue living active, fulfilling lives at every age. Throughout my career, I've cared for men in their 30s who were worried because they noticed reduced sensitivity. I've spoken with men in their 60s who believed their intimate lives were over. I've also worked with men in their 80s who continue to enjoy healthy relationships because they chose to take care of themselves rather than ignore the warning signs. The difference between these groups is rarely luck. More often, it's knowledge. The men who continue thriving usually understand what habits to avoid, what symptoms deserve attention, and how to properly care for their bodies before small issues become major ones. That's exactly why we're having this conversation today. The 10 mistakes we're about to discuss don't just influence erections. They affect confidence, emotional well-being, relationships, and your ability to enjoy life with strength and dignity. Let's begin with the first and perhaps the most important point of all. Never ignore changes in your penis. This is the mistake I wish fewer men made. When your erections aren't as firm as they once were, when morning erections become less frequent, or when sexual arousal simply feels different than it used to. Those changes are rarely random. Very often, they're connected to reduced blood flow, early narrowing of blood vessels, changes in nerve sensitivity, hormone shifts, or other medical conditions that deserve proper evaluation. Many men try to convince themselves everything will return to normal on its own. Unfortunately, delaying action usually allows the problem to become more difficult to treat. The physical changes are only one part of the story. The emotional effects can be just as significant. A man who begins losing confidence in his erections often starts avoiding intimacy. He may become anxious before sexual activity. He may create excuses to avoid closeness. Over time, he may even begin questioning his masculinity, despite the fact that these problems are often medical, not personal. The good news is that many of these conditions respond much better when they're identified early. That's why I always encourage my patients to pay attention instead of pretending nothing has changed. Notice your body. Observe any differences. If something unusual continues for several weeks, don't wait months or even years before asking for professional advice. Early action can prevent years of frustration and preserve both your health and your confidence. The second mistake is trusting dangerous home remedies that promise miracle results. I truly wish this weren't so common, but over the years I've treated men who injured themselves after following advice they found online or heard from someone without medical training. I've seen chemical burns caused by household products. I've seen injuries from homemade devices built using bottles, elastic materials, or metal rings. I've treated men who believed internet myths instead of seeking proper medical care. Biologically, these unsafe methods can damage delicate nerves, reduce blood flow, create permanent scar tissue, and in severe cases, even lead to irreversible erectile dysfunction. Unfortunately, these situations often begin with fear. Many men feel embarrassed. They worry they aren't performing well enough. They become desperate for a quick solution. But desperation often leads people toward the most dangerous decisions. The truth is this: you do not need unsafe shortcuts. If you're considering enlargement products, unapproved gels, excessive vacuum devices, or constriction techniques that haven't been recommended by a healthcare professional, stop and think carefully before putting your long-term health at risk. Your body deserves evidence-based care, not internet experiments. Protecting what you already have is always wiser than gambling with treatments that promise everything while delivering permanent damage. Gentlemen, let's continue because the next few habits may seem harmless on the surface, yet they can quietly affect your health in ways many men never expect. The third mistake is neglecting proper hygiene. It sounds simple. In fact, many people assume it's too basic to even discuss. But in my practice, I continue to see preventable infections and irritation caused by poor daily hygiene, especially among men who are uncircumcised. If you still have your foreskin, it's important to gently retract it during your daily shower. Clean underneath with warm water and a mild cleanser if needed, and carefully dry the area afterward. When this routine is ignored, natural oils, dead skin cells, moisture, and bacteria begin to collect beneath the foreskin. Over time, this buildup forms a substance known as smegma. Although it can be removed with proper cleaning, allowing it to accumulate creates the perfect environment for bacteria and yeast to grow. Biologically, this may lead to inflammation, unpleasant odors, irritation, infections, and painful conditions such as balanitis. In rare situations, long-term poor hygiene has also been associated with an increased risk of penile cancer. Emotionally, these problems often create embarrassment. Some men become self-conscious during intimacy. Others avoid sexual relationships altogether because they fear being judged or rejected. That emotional burden can slowly damage confidence just as much as the physical discomfort. From a practical standpoint, maintaining good hygiene is one of the easiest ways to protect your health. You don't need expensive products or complicated routines. Gentle daily washing with warm water, mild soap when appropriate, and careful drying are usually enough. Avoid harsh scrubbing. Avoid heavily scented products that may irritate sensitive skin. Think of it the same way you think about brushing your teeth. A few minutes of daily care can prevent much bigger problems later in life. Now let's move to the fourth mistake. Never ignore pain, bleeding, unusual lumps, or sores. Your penis should not constantly hurt. Pain is never something your body produces without a reason. Whether the discomfort appears during urination, during an erection, during sexual activity, or even while resting, it deserves attention. The same is true if you notice blood in your urine, blood in your semen, unexplained swelling, ulcers, firm lumps, or changes in the appearance of the skin. These are not simply signs of aging. They are warning signals that something inside your body needs to be evaluated. Biologically, these symptoms may point toward urinary tract infections, sexually transmitted infections, kidney stones, Peyronie's disease, inflammatory conditions, or in some cases, even cancer. Of course, not every symptom means something serious. But without a proper examination, there is no safe way to know. Many men delay making an appointment because they hope the problem will disappear on its own. Others feel embarrassed discussing intimate concerns. Unfortunately, that delay often allows a treatable condition to become much more complicated. Emotionally, ignoring these symptoms creates ongoing anxiety. You may find yourself constantly wondering whether something is seriously wrong. That uncertainty increases stress, and stress alone can negatively affect sexual function. Practically speaking, early diagnosis almost always gives us more treatment options and better outcomes. Medicine works best when we address problems before they become emergencies. So if you notice pain, bleeding, new lumps, persistent sores, or anything that simply doesn't seem normal, don't wait. Speaking with your doctor isn't a sign of weakness. It's one of the smartest decisions you can make for your future health. The fifth mistake is losing control during sexual activity. Passion is an important part of intimacy, but allowing excitement to replace awareness can sometimes result in serious injury. Many people don't realize that penile fractures are real medical emergencies. Although there is no bone inside the penis, the tissue surrounding the erectile chambers can tear if an erect penis suddenly bends with force. This usually happens during vigorous intercourse when the penis accidentally slips out and strikes the partner's body instead of re-entering smoothly. The injury often produces a sudden popping sound, followed by immediate pain, rapid swelling, bruising, and a quick loss of the erection. Biologically, this rupture damages the protective tissue that allows normal erectile function. Without prompt surgical treatment, permanent curvature, scar formation, painful erections, and long-term erectile dysfunction become much more likely. Emotionally, this kind of injury can leave a lasting psychological impact. Even after physical healing, many men develop fear about future sexual activity. Some become anxious every time intimacy begins. Others lose confidence because they worry the same injury could happen again. Those emotional effects deserve just as much attention as the physical recovery. From a practical perspective, prevention is much easier than treatment. There's no need to rush. Sex should never feel like a competition. Move with awareness. Communicate with your partner. If extra lubrication is needed, use it generously. Adequate lubrication reduces unnecessary friction and lowers the chance of accidental injury. Remember that intimacy is built on comfort, communication, and connection. Moving more carefully doesn't reduce pleasure. In many cases, it actually improves it. Now let's talk about the sixth mistake, and it's one that surprisingly few men think about. Don't expose your testicles to excessive heat for long periods of time. Nature designed the testicles to remain outside the body for a very important reason. They require a temperature slightly lower than normal body temperature in order to produce healthy sperm and maintain normal testosterone production. When that cooling system is disrupted repeatedly, their function can begin to decline. Spending long periods in extremely hot tubs, frequent sauna sessions, placing a laptop directly on your lap for hours, wearing excessively tight clothing every day, or exposing the groin to continuous heat may gradually raise scrotal temperature. While occasional exposure isn't usually a major concern, repeated and prolonged heat can become a problem. Biologically, higher temperatures may reduce sperm production, lower sperm quality, and place additional stress on the cells responsible for producing testosterone. For men hoping to maintain fertility or preserve hormonal health as they age, this is especially important. Emotionally, declining testosterone often affects much more than sexual desire. Many men begin noticing lower motivation, reduced energy, increased fatigue, irritability, difficulty concentrating, and a gradual loss of confidence. Sometimes they blame aging alone, when in reality, several lifestyle habits are contributing to the problem. Practically, protecting your testicles doesn't require major lifestyle changes. Take breaks from prolonged heat. Avoid keeping hot electronic devices directly against your body for extended periods. Choose comfortable, breathable underwear whenever possible. Small adjustments like these help create the environment your reproductive system was naturally designed to function in. Your future vitality depends on many small choices made consistently over time. Gentlemen, let's continue because the next habits are incredibly common, yet many men never realize the long-term effect they can have on sexual health, confidence, and overall well-being. The seventh mistake is being too aggressive during masturbation. This is a topic many men feel uncomfortable discussing, but it's far more common than most people realize. In my practice, I've spoken with countless patients who were surprised to learn that the way they masturbate can influence their sexual experiences with a partner. When excessive force, an extremely tight grip, or repetitive high-pressure stimulation becomes a regular habit, the nerves and brain begin adapting to that specific type of sensation. Over time, your body starts expecting that exact level of pressure every time sexual stimulation occurs. Many professionals refer to this as death grip syndrome. Although it isn't an official medical diagnosis, it accurately describes a pattern I see quite often. Biologically, repeatedly using excessive pressure may reduce sensitivity and make it much more difficult to become aroused during normal sexual activity. Your brain gradually associates pleasure with one very specific form of stimulation, instead of responding naturally to different types of touch. As a result, erections may become harder to maintain during intercourse, orgasms may take much longer to achieve, or satisfaction may decrease altogether. Emotionally, this often creates confusion and frustration. Many men begin wondering whether something is physically wrong with them. Some blame themselves. Others assume their relationship is the problem. In reality, the issue may simply be that the body has adapted to one repetitive pattern over many years. That frustration can gradually affect confidence and make intimacy feel stressful instead of enjoyable. From a practical standpoint, the solution is usually straightforward. Slow down. Avoid excessive pressure. Use lubrication whenever possible to reduce friction. Allow yourself to experience different types of stimulation instead of repeating the exact same technique every time. Giving your nervous system greater variety helps restore more natural sensitivity over time. Remember, your body responds best when it's allowed to function naturally, rather than being forced into one rigid routine. Now let's move on to the eighth mistake. Don't smoke, and take care of your entire body. If I had to choose one lifestyle habit that consistently damages erectile function faster than most others, smoking would be near the top of the list. Many men think smoking only affects their lungs. Unfortunately, the damage extends throughout the entire cardiovascular system. Every erection depends on healthy blood vessels delivering adequate blood flow into the erectile tissue. Smoking slowly injures those blood vessels. The chemicals inside tobacco damage the inner lining of arteries, reduce nitric oxide production, increase inflammation, and make circulation less efficient. Over time, the blood vessels become narrower and less flexible. When blood cannot flow properly, erections naturally become weaker, less reliable, or disappear altogether. Biologically, smoking also increases the risk of bladder cancer, kidney disease, vascular disease, and numerous other serious medical conditions that directly affect men's health. It's not simply about sexual performance. It's about protecting every major organ in your body. Emotionally, many smokers tell me they never expected cigarettes to affect their confidence or intimate relationships. They assumed it was just another daily habit. Then one day they notice their erections becoming inconsistent. That realization often feels like a betrayal. Something that once seemed harmless quietly stole an important part of their vitality. The encouraging news is that the body has an incredible ability to recover when you give it the opportunity. Stopping smoking allows circulation to gradually improve. Blood vessel function begins repairing itself. Your heart benefits. Your lungs benefit. And in many men, erectile function also improves over time. Of course, smoking is only one part of the equation. Regular physical activity strengthens your cardiovascular system. Nutritious food supports healthy blood vessels and hormone balance. Maintaining a healthy weight reduces inflammation. Managing stress protects both your mental health and your sexual function. Limiting excessive alcohol helps preserve nerve function and testosterone levels. These habits are all connected. Healthy erections are not separate from a healthy lifestyle. In many ways, they are one of the clearest rewards your body gives you for taking care of yourself. The ninth mistake is one that receives far less attention than it deserves. Don't be so hard on yourself. As men, many of us grow up believing our value depends on always performing perfectly. We tie confidence, masculinity, and self-worth to what happens in the bedroom. But that's simply not how the human body works. Every man experiences occasional changes in sexual performance. Fatigue, stress, poor sleep, illness, relationship tension, anxiety. Even a difficult day at work can temporarily affect an erection. One imperfect experience does not mean something is permanently wrong. Unfortunately, many men interpret a single episode as proof that they're failing. That negative thinking quickly creates performance anxiety. Biologically, anxiety activates your body's stress response. Stress hormones, particularly cortisol and adrenaline, redirect blood flow away from sexual organs and prepare the body for survival instead of intimacy. Even if your blood vessels, hormones, and nerves are perfectly healthy, excessive anxiety alone can interfere with normal erectile function. Emotionally, this creates a vicious cycle. One disappointing experience leads to fear. Fear creates anxiety. Anxiety leads to another disappointing experience. With each repetition, confidence decreases a little more. Soon, the anticipation of failure becomes more powerful than the desire for intimacy itself. Practically speaking, breaking this cycle begins with self-compassion. Treat yourself with the same patience you would offer someone you care about. Talk openly with your partner instead of suffering in silence. If anxiety continues affecting your quality of life, don't hesitate to speak with a healthcare professional or therapist. Seeking help is not weakness. It's an investment in your health, your relationships, and your future happiness. Always remember this. One difficult night does not define your masculinity. It does not determine your worth. And it certainly does not predict your future. Your body is remarkably resilient when you respond with understanding instead of criticism. Gentlemen, now we reach the final mistake on our list, and this is one that many men overlook because they don't understand how important regular sexual function is for long-term penile health. The 10th mistake is completely stopping sexual activity and believing it no longer matters. You may have heard the phrase, use it or lose it. While this phrase is often used casually, there is actually some truth behind the idea. Your body is designed to function through regular activity, and erections are an important part of maintaining healthy penile tissue. Biologically, erections increase blood flow into the erectile chambers. That blood flow delivers oxygen and nutrients that help maintain the flexibility and health of the tissues. When erections become very infrequent for long periods of time, some men may experience changes such as reduced elasticity, increased scar tissue formation, and decreased responsiveness. This is especially important for men who already have medical conditions that affect circulation, such as diabetes, high blood pressure, or cardiovascular disease. The goal is not to create pressure or make intimacy feel like a responsibility. Sexual health is not about forcing yourself to meet a certain standard. It's about understanding that your body benefits from healthy circulation, stimulation, and connection. Emotionally, intimacy represents much more than physical activity. For many men and their partners, it represents affection, closeness, trust, and emotional connection. When a man completely withdraws from intimacy because of fear, embarrassment, or the belief that aging means the end of sexual life, he may also lose an important source of confidence and connection. Practically, maintaining sexual health can take different forms depending on your situation. For some men, it may involve intimacy with a partner. For others, it may involve gentle self-stimulation. For others, Important conversation, I want you to remember one thing above everything else. Your health is not something you should ignore until a problem becomes impossible to overlook. Your body is constantly communicating with you. The small changes you notice today may be the information you need to make better decisions for tomorrow. Too many men spend years suffering quietly because they believe certain health concerns are too embarrassing to discuss. They avoid appointments. They search for secret solutions online. They convince themselves that problems will simply disappear. But your health does not improve through silence. It improves through awareness, knowledge, and action. There is no shame in wanting to understand your body better. There is no weakness in asking for help. In fact, recognizing that something needs attention is one of the strongest decisions a man can make. Throughout this video, we discuss 10 important mistakes that can negatively affect your erections, your confidence, and your overall quality of life. We talked about the importance of paying attention to changes instead of ignoring them. We discussed why dangerous home remedies can create more harm than good. We explained why proper hygiene matters. We covered why pain, bleeding, lumps, and unusual symptoms should never be dismissed. We talked about protecting yourself during intimacy. We discussed the importance of maintaining a healthy environment for your testicles. We explored how certain habits can affect sensitivity and sexual response. We explained how smoking and poor lifestyle choices damage the blood vessels responsible for erections. We talked about the emotional impact of anxiety and self-criticism. And finally, we discussed why staying connected with your sexual health remains important throughout life. But I want to make something very clear. Taking care of your sexual health does not mean chasing perfection. It does not mean you have to compare yourself to unrealistic expectations. It does not mean your value as a man depends on your performance. Your worth goes far beyond that. A healthy relationship with your body comes from understanding it, respecting it, and caring for it. Aging is not the enemy. Many men believe that getting older automatically means losing strength, confidence, and intimacy. That simply is not true. The reality is that aging gives you the opportunity to become more aware of your body and make smarter choices. Many younger men ignore their health because they believe they have unlimited time. But experienced men understand that prevention, consistency, and self-care create long-term strength. Your confidence does not disappear as you age. It changes. It becomes built on knowledge, maturity, and the ability to take responsibility for yourself. If you are currently experiencing erectile difficulties, reduced desire, discomfort, or any other concerns, do not assume you have to accept them as a permanent part of life. Many conditions affecting men's sexual health can be evaluated, managed, and improved with the right approach. Modern medicine has many options. Lifestyle changes can make a significant difference. And the first step is always the same. Start the conversation. Speak with a qualified healthcare professional. Ask questions. Learn what is happening inside your body. The more you understand, the more control you regain. Remember, your penis is not separate from your overall health. It reflects your circulation. It reflects your nervous system. It reflects your hormones. It reflects your emotional well-being. When you take care of your entire body, you naturally support your sexual health as well. This is why I encourage every man watching this video to think beyond quick fixes. Don't look for one magic solution. Build a complete foundation. Move your body regularly. Eat foods that support heart health. Maintain a healthy weight. Get quality sleep. Manage stress. Avoid smoking. Drink responsibly. Keep up with medical checkups. These simple habits may not seem powerful individually, but together, they create the environment your body needs to function at its best. And please remember something important. If you have struggled with any of the issues we discussed today, you are not alone. Millions of men experience similar challenges. The difference between continuing to struggle and moving toward improvement often comes down to one decision. The decision to stop ignoring the problem and start caring for yourself. Your body is not your enemy. It is your partner. It has carried you through every stage of your life. It deserves your attention, your respect, and your care. So starting today, make a commitment. Listen to your body. Protect your health. Respect your future. Do not wait for a crisis before making changes. The best time to take care of yourself is before a problem becomes serious. Small improvements today can create a healthier, more confident tomorrow. And remember, true confidence does not come from pretending nothing is wrong. True confidence comes from having the courage to face challenges and take action. Whether you are 30, 50, 70, or beyond, your health still matters. Your relationships still matter. Your happiness still matters. Your quality of life still matters. You are never too old to make better choices. You are never too old to improve your health. And you are never too old to feel confident in who you are. If this information helped you, consider subscribing to the channel and sharing this video with another man who may need to hear this message. Sometimes the most important conversations are the ones people are too uncomfortable to start. By sharing knowledge, you may help someone take the first step toward better health. Thank you for spending this time with me. Take care of yourself. Listen to your body. Protect your health. Because you deserve a life filled with confidence, connection, and strength. I'm Dr. Jocelyn, and I'll see you in the next video. Until then, remember this. Your health is your responsibility, but you don't have to face the journey alone.